I'm Cindy McDaniel with Total Health Partners, and we're going to review the slides for our marketing plan. Our plan really aligns with the vision and mission of Total Health Partners, and that is to engage. Our mission is to engage in a convenient way with millennials in the workforce of self-funded organizations to provide physical, mental, and nutritional health. This slide shows a couple of the demographics for the Roanoke market in which we want to locate Total Health Partners. And I want to just point out a couple areas here. One, which is the overall growth population in the area, which is over 99,000 people with over 77,000 adults. And the median age in the area is 38.7, which is a really good age group in which we are trying to attract. And also, if you look at the household incomes here, which also looks very good, which is over $59,000. And then for your married family income, that's almost $92,000. In this slide, we want to look at the Roanoke employers, and you'll notice that Carilion, of course, is the largest with over 10,000 people, but we also have a number of employers that are over 1,000 people, so those are good contacts for us. You'll see some of the ones down here, which is Roanoke City and Roanoke County, and those are self-funded organizations, as well as other companies such as Wells Fargo and Kroger. So I want you to notice one other thing about this slide is that in 2016, one of the other things that we addressed in Total Health Partners is between 7.74 and 8.71 of the adults have some type of depressive disorder. And I think that's significant that we can address that. So we'll move on to the next slide. In this slide, we looked at price, product, place, and promotion. And of course, price, we're looking at 30% less than your average cost. Product, it's the direct care product, our direct provider product. Place, it's in a retail setting, and the promotion will be doing indirect and direct promoting that I'll discuss later in another slide. In this slide, you'll see that how we arrived at the price point. You'll notice what the cost is up here through some of these, particularly the millennial cost, as well as the price points for health insurance for a single employee versus a family employee, which is from $7,000 to over $20,000. So therefore, Total Health Partners has really came up with a single price at around a little over $5,000, and for a family, a little over $14,000. And we're looking at the average medical cost at a little over $3,000, which is which we feel like this will really reduce the price roughly around 30% for an employer. Our target market is millennials and self-insured organizations. Who is our competition? Well, Vicorp certainly is competition. It is a third-party administrator in the area. It's actually out of Roanoke, and it works with the counties in Virginia. And it really manages their workers' comp, as well as, I believe, some of their health insurance claims. But it's mostly it mostly manages claims. Now, when I looked at another model very similar to this model, although it was just primary care, and that was out of Texas, and it's called Euphoria Health in Texas. And it's just it is a primary care provider that works directly with employees or employers, I'm sorry. And according to the Direct Primary Care Coalition, Virginia actually only has 3 that would be our competition, and that's in Northern Virginia. This model, I believe, is going to take off soon. I think we're at the forefront of it because CMS is actually rolling out a way to pay directly. And basically what we're gearing towards is accountable care organizations, which is what Medicare and Medicaid has been working on. So this fits in nicely with that. To review the pestle analysis for Total Health Partners, we look at the political situation which we have right now with the pandemic. We don't know where the Affordable Care Act is going in per se. We have some things that certainly could benefit a direct provider such as Total Health Partners in terms of pricing transparency. There's also a new law that came out that would would no longer recognize the direct providers as a health plan, and that's a benefit. And there's also a new proposal for some tax incentives as well. Economically, we're looking at what is the downturn going to do? What's this pandemic going to do? It may be helpful. It may be something that would be a high, certainly high on the list for Total Health Partners to consider. Is it the timing correct to move forward, or should we hold off a little bit? But then again, we just need to look at that. Socially, we need to look at what do the millennials think in terms of locality. They may have diversity from one locality to another. However, in this area, you can see that we do have a lot of younger people, so that would be a positive in the Roanoke market. From a technological standpoint, we need as a company to look and be prepared for ransomware or for anything in regard to cybersecurity to ensure that we have um, all of that taken care of. And we are going to be a company that looks really closely at technology to be on the forefront on a continuing basis. Environmentally, we may have to look at our supply chain. What does the PPE supply chain look like in the future? Legally, when we're looking at it from an HR standpoint, and from where just the minimum wage change, that may not really affect Total Health Partners as much because we use a higher level of professional. I won't spend too much time on this slide because some of it's very similar than the previous slide, other than I'll talk about the strengths, which this really is just an innovative care model. It's a direct care model, and then go over here and look at our weaknesses, which there's just no historical outcome data beyond the direct primary care model, and we really need to look at establishing a true capitated price point as well as establishing some true carve-out pricing. Our threats, which are very much the same as the previous slide, and our opportunities, some of those are very similar as well. This is our communication and distribution. We're going to work on educating HR directors and CEOs of self-funded organizations to promote and showcase Total Health Partners. We'll also do quite a bit of networking within the Roanoke market and in terms of Chamber of Commerce, Rotary, the B2B communication. Plus, we'll set up with local networks as we're setting that up. That'll be an indirect way of communicating what Total Health Partners provides, as well as really focusing on our social media with our web page.